All right. Well, we are going to go ahead and get started. My name is Anne Marie Kelly, and I work in the benefits team here at Brand Safeway, and we are very excited to be right on the eve of open enrollment for 2025. We're going to spend a few minutes just walking through some top things to know, a little bit about healthcare and the inflation that we're seeing, and Brand Safeway's sort of response to that. And then we're going to go into some more of the benefit details, and then close it out with any Q&A that you all have. So again, thank you for your time and attention. We'll try to keep the comments here to as short as possible to give everyone plenty of time to ask questions. If you'd like to, as I'm talking, I've got a few other friends of mine in the benefits team on the call today, and if you have any questions, feel free to type those into the chat feature of the call, and we will address those. And if need be, they'll let me know if I need to do a voiceover, but they may be able to just respond to you directly in the chat as we're talking. Okay, and with that, I am going to get going. So again, I'm Anne Marie Kelly, and work here in the benefits team, and we are going to rock and roll here. So um, a few important notes on open enrollment. We do open our enrollment on November 1st. That is Friday of this week, and it will run for 15 days through November 15th. This is an active enrollment, and what that means is that employees must go in and make their elections. Our elections do not carry over into 2025, so it is an active enrollment. The enrollment platform remains the same at brandsafewaybenefits.com. And then same eligibility as we've had in years past. And so that's our top things to know. I wanted to spend a few minutes just at the top of the call on the highlights. Uh, for the most part, everything is pretty much staying the same, which in the benefits and healthcare world, that's actually a really good thing. We will continue to offer our very large payroll incentive to for those who complete the biometric screening, who are enrolled in the CDHP plan. We also will maintain the same vendor partners and benefit plan offerings, same tools and resources. If you're enrolled in the CDHP, which is our consumer driven health plan, our medical plan, we are utilizing the same provider network. I always urge everyone to just double check that their providers remain in network, because providers can come in and out of the network throughout the year, but we will still be leveraging the same network, and we will still have the same health savings account employer match. That is $250 for the employee only tier and up to $500 for employee plus dependent tiers. What is changing is that we will have a small increase in our CDHP plan payroll deductions. If you recall, we've actually held rates flat for the last 2 years, and Brand Safeway has really worked to try to absorb that inflation exposure that we've had. But this year we will increase it amounts to about $5 per month for employee only tier in the lowest salary band. And we'll get into a little bit more about healthcare inflation in just a minute. We also have a few slight enhancements to some of our ancillary benefits programs. We're rolling out an active and fit partnership. This is a gym discount membership across over 10,000 gyms and studios nationwide. It's through Active and Fit, and it's just $28 per month. So this is actually available today. It was effective December 1st. And you can navigate to our benefits intranet SharePoint page, or you can access the Brand Safeway specific link in the enrollment flow on the home page to take advantage of this discount. And then, of course, we are running the biometric screening program this year. We are working toward a 60% participation in our program this year. And so we've been providing reporting to our leaders. Now, we don't provide individual names or anything that's actually a HIPAA violation, but we do provide rolled up aggregate reporting. And speaking of that, Brand Safeway does not receive any individual's metrics or health information that is against the HIPAA rules. So we only know that someone has actually participated with a yes or a no field from our health advocate vendor who manages this program. But we are tracking our participation across the company and trying to really drive a 60% participation this year. And then finally, what's next? Hopefully you all have seen your open enrollment guides. Those began hitting mails last week. We also have posted those to the benefit intranet SharePoint page. And then, of course, they will be posted in the enrollment flow as well. And again, it's an active enrollment beginning November 1st, which is Friday. And one other update here at the top of the call is just all passwords to the brandsafewaybenefits.com website. We do update or reset those passwords very late on October 31st. We find that this is the way that allows everyone to kind of get back into the system each year and remove the login barriers by just resetting those passwords to your birth date in year, month, day format. So that is just the high level highlights, and we will now get into a little bit about healthcare inflation. So hopefully you can see the screen here. You see a green line that is medical care inflation. And this is over the past 24 years in the United States. And then you see the blue line. This is all other goods and services in the US. And so you can see very quickly here that healthcare outpaces inflation of everything else. And so, you know, what do we do as large employers, in delivering or providing healthcare to our employees and their families to try to help manage this? Well, one thing to know about healthcare is that for a majority of large employers in the United States, they self-insure their healthcare program. What that means is that when you go and utilize services in the system, you pay your deductible all the way up to your out-of-pocket maximum, but you are completely capped at that out-of-pocket maximum based on our plan, our CDHP plan design. But Brand Safeway pays all of the remaining expenses that can be incurred, and that's an unlimited expense because our CDHP plan is fully comprehensive, meaning no matter what the services are, if they are required, then and paid, then that means that Brand Safeway covers that bill. So as we think about the fact that we have an unlimited benefit that caps our employees at a certain amount, and then we've also got this healthcare inflation happening, it really helps us remember, what do we do to help manage this? And then what does Brand Safeway do to help manage this? So what I'm going to do is walk through an overview of our plan and how our plan works, and then I'll kind of summarize sort of what does Brand Safeway do and what employees do. First, I want to just share the way that our CDHP plan design is set up. One of the things about a high deductible health plan, this is a program that the government has put into place that requires employees meet a certain deductible before the plan will pay any expenses. In return of having that high deductible, we are also given the ability to have a health savings account. And this health savings account allows us to put our a portion of our paycheck into it with pre-tax dollars. And then that savings can roll over year to year, because this health savings account is just like a personal banking account. And so that is what is the strong feature of having a high deductible health plan, is actually also having a health savings account where you can continue to save money to use for healthcare expenses that you could even invest, and it can roll over year to year. And so that is the type of health plan that Brand Safeway offers, this high deductible plan, which we call our consumer driven health plan. And you'll see here that it covers preventative care at 100%. It's completely free. Now, when we say free, it just means it's free to the members that are utilizing that care. Certainly, Brand Safeway is paying for the preventative screenings, but I'll tell you, Brand Safeway would rather pay for many, many more preventative screenings that help detect cancer early, because that truly does save lives. And we are all about making sure we're taking care of our employees and their family members. And so this is a huge feature to our plan that we want everyone to try to take advantage of. And then you see this annual out-of-pocket maximum as well here. It's $4,500 for an employee. And again, what that means is that no matter what happens in the healthcare system, no matter whether the bill is $100,000 or $1 million in total, that means the employee will never pay more than $4,500. And so that is the true insurance here, that with your payroll deductions, you are ensuring that you would never pay more than $4,500 in a given year. Okay, so that's the way that this works. And then the final piece to mention here is what we call an embedded deductible. You don't have to remember that terminology, but all this means is that if you are covering a family member, then that means that you are in sort of this right-hand column where you've got an annual family deductible of $4,000 and an annual out-of-pocket maximum of $9,000. But what this embedded deductible will do is it actually caps the total individual deductible at $3,300 for one individual that is enrolled in a family plan. This is the very lowest minimum we have the opportunity to choose based on the IRS rules. Okay, so this isn't something that we actually, determine ourselves at Brand Safeway. These are IRS specific rules, but we want to ensure we're capping everybody at the minimum that they would have to put out as an individual that's in a family plan. But that's a little bit about the way the HSA or the CDHP works. It also includes pharmacy coverage, and our pharmacy benefit is through Empirics Health. You'll see here the sort of benefits schedule that we have. I will say that if you are on maintenance medications, really do try to take advantage of the 90-day supply, because you get your medications at a lower price than if you were to buy your medications at each 30-day supply. Another feature to our plan that we were able to do this year was to extend the 90-day supply to many retail chain pharmacies like CVS and Kroger family of pharmacies and Walmart and Walgreens and others. You could pick up your 90-day supply at the retail pharmacy if you did not want to use mail order, and still take advantage of that mail order pricing. The other call out that I'll make here is that preventative medications are also available at zero cost under our plan. So if you are on a medication that is considered preventative, and this is again dictated by the government, by the IRS, as to what is preventative, you can get that for 100% covered, meaning the plan pays for that, even if you haven't met your deductible. And that preventative list will be available here in the next month or so for 2025. The one that is for 2024 is posted out on our Quantum Care website. And in your OE guide, it'll explain where you can find that list as well. I already mentioned a little bit about preventative care, but another piece to mention here in the blue box is that when you utilize a service that we offer under the CDHP, you could actually get rewards, a $20 check or a $30 check or even up to a $100 check, depending on what you're searching for in the Healthcare Blue Book website, will dictate the rewards amounts that you receive. But I even actually got a gift card in the mail from Healthcare Blue Book for looking up a mammogram on their website earlier this year. So it works. It definitely works. So this feature even pays you to go get your annual screening. We always provide this snapshot of the different level of care. In the U.S., we have a lot of access to a lot of different care, which is really great. This is not for all the inflation and the other concerns that we have in the U.S. Access to care is typically not a problem for us here, but because there are so many different options, you really can, spend, 2 to 5 times more than you may otherwise have to, depending on where you go for what you need. So this is just a reminder that it's always important to know kind of where you're going to go for specific care needs before you're in the middle of the emergency and need to get care immediately. Take a minute just to take note of the urgent care facilities near you, or the primary. If you don't have a primary care physician, make sure you get one, or even utilizing our telehealth virtual care through Teladoc. These are all ways that you can save money and potentially get more convenient care than you would otherwise having to go to the emergency room. I mentioned our quantum health care coordinators. As part of having enrollment in our medical plan, the CDHP, we put a lot of different benefits and resources and services around you to help support you, not only be a smart healthcare consumer, but then for them to help clinically guide, as you're trying to determine what to do, where to go, how to get that second opinion. They help support anything and everything as it relates to healthcare, and they know our programs and plan in and out, so they can really serve to help navigate you through healthcare. And that's really what Quantum Health is for. Then we mentioned Healthcare Blue Book. They offer that pricing transparency tool. It really just helps you to find facilities that may do the same service at different prices. And again, that goes back to the fact that we have a lot of access in the US, but they are not all created equal. And so this tool helps you to find the lowest cost at the highest quality, so that you can, be that smart healthcare consumer. Surgery Plus is a similar type of program that we offer. They're actually rebranding to Lantern in 2025, so you may see us refer to them as Lantern. But this is a program that helps if you know you're going to have a surgery upcoming, and you're kind of looking for high quality and low cost, then call the Quantum Health Care coordinators and get connected with Surgery Plus, because they have networks of providers that do this a certain set of surgeries all day long, every day. I mean, you definitely want to go get surgery from a physician or a doctor who has done the procedure over 100 times in their career, right? It means they've seen everything, all the different things that could come up, and they know exactly how to do this. And so it really helps to get that. And then in addition to high quality, you also get a much lower cost because your co-insurance is waived completely when you utilize this network of providers. And it's because they can bundle all of the different charges that occur within a surgery, a full episode of care surgery, to deliver a lower cost across the board, which then allows for that savings to be passed to you through waiving of some of your out-of-pocket expenses. So definitely, if you've got something coming up that you can prepare for, a surgery that is one that you schedule out in advance, definitely recommend checking this group out. I mentioned Teladoc as well earlier, but there was an IRS CMS relief that allowed us to provide a $20 copay, even though we had a high deductible health plan in 2024. That relief, we believe, we know it's set to expire by the end of this calendar year. We do not believe that HHS and IRS will actually renew that relief. So we will go back to paying the full cost, which you see here as the consultation fees listed, before you meet your deductible. But even still, it $56 for a medical need that allows you to stay in your home and potentially get the prescription you need filled. It may be worth it for you. So it's always an option to utilize Teladoc. All right, so we're here at the discounted premiums for the CDHP. You'll see that they did go up just a touch from 2024. This is reflecting the discounted rate both for the biometric screening as well as the tobacco-free discount. When we go into our enrollment for 2025, you will be asked, just as always, are you a tobacco user, or have you completed the tobacco cessation program? And so that remains the same. You will also have a question that says, did you complete your biometric screening, or do you intend to complete your biometric screening? If you say yes, you do want to complete it, then the premium rates that you see in the enrollment will reflect that you have completed that screening. So that's the way that we're setting up our enrollment this year. So definitely, keep that in mind. If you are not sure if you'll get your screening completed by November 15th, go ahead and say that you will complete it. But we will have a process by which we get our completion report and compare that up to what all of our employees attested to in the flow, whether they were going to do it or not. And then we'll make the final payroll deduction adjustments accordingly. But for the biometric screening, do know that for the first time this year, we will have the deadline of November 15th, but if for some reason you do not get your screening done by then, we will still take completions after November 15th, okay? So one of the things that we want to do is we don't want to cut people off of doing what we believe is the right thing to do to stay proactive and preventative in our healthcare. And so if you get your biometric screening done after November 15th, we will get that payroll discount turned on as soon as we can administratively possible. If you get your screening completed by November 15th, you will be assured that you get your premium discount on your first paycheck in January. If you do not, but you have completed it at some point after November 15th, it will take up to 4 weeks for us to get that completion applied in all of the systems and downstream through the payroll system. But we will turn that discount on prospectively or going forward once we get that completion in. Okay. So definitely, even if you hadn't gotten it set up to get done yet, still go out and get it set up with a LabCorp. It takes about 15 minutes to complete that biometric screening once you get it done. So, because you will get the discount once we can get that recorded. Okay. Now, here are the non-discounted premiums. You can tell there's just a significant difference between the two. And that is because that biometric screening discount is worth $1,500 a year. And that is just not just for the employee, but also if you're covering a spouse for them as well, it goes up to $3,000 for both an employee and a spouse. And then the tobacco discount is $500 for employee and then $500 for spouse. So you can see sort of right away, looking at these numbers and the difference between the two, how important it is and how much where Brand Safeway believes in proactive and preventative health, because it really does make a difference, not only in the quality of each and every one of our lives, but also, supporting from a financial standpoint, the plan. And so kind of wrapping up from, that earlier discussion about inflation and the impact that has on the increasing cost in the nation, in the United States of healthcare. What are we doing as a company about it versus what our employees can do? Well, what we are doing is aggressively negotiating all year long. I mean, it isn't just a short season and then we move on. No, we are working toward trying to continue to provide the broadest access to all the providers that our members want to utilize, but really trying to cut down to that lowest net cost. But maintaining quality in our providers, and then all of those resources that we just walked through that come along with the enrollment in the CDHP plan, those are there for a reason, to really help support our employees to make smart choices in terms of the healthcare that they're utilizing, finding quality providers at the lowest net cost. And then, as I mentioned, I mean, Brand Safeway has absorbed the increase in inflation the last couple of years. This year, we did need to share a little bit, but Brand Safeway continues to absorb a majority of that increase even this year. And then in addition, of course, we're providing, incentives and premium discounts to, do those preventative care and remaining healthy. So, what employees can do is really, honestly, just focusing on that preventative care, being proactive with knowing your numbers, the biometric screening program, and then just continuing to use the tools and resources we provide to help employees be, smart healthcare consumers. And we talked a little bit about earning these discounts. So I'm going to just sort of move past this. We do have information out. And in fact, Amanda or Heather may be able to post our little one-pager about how to get the biometric screening done. It's just a one-page PDF that talks about how to complete that process. And then in the tobacco cessation, we'll share more in the open enrollment flow about that, if that applies to you. Okay, and then we're going to get into the health savings account, because that is really sort of the bell and the whistle that come along with the high deductible health plan, is really having this health savings account that not only you contribute to, but then Brand Safeway matches your money in that account, and then you can allow that account to grow over time. Okay, and it just continues to roll over year after year. It is your individual personal banking account, and then you can use it for any healthcare services that you have. So that is the way that this HSA works. There is because it is a individual banking account, there is a process that is required called the CIP, the Customer Identification Program. If you're brand new and don't have a health savings account with Brand Safeway yet, you will walk through this process. It's sort of an automated process with Fidelity, who is our administrator for this program. We also offer flexible spending accounts. So if there are folks out there that are not going to be in the high deductible health plan or our CDHP, but are electing a different type of plan, or maybe they have a PPO plan with a spouse's coverage or something, you can still elect the flexible spending account. This is the one that allows you to put money, pre-tax money, into the account throughout the year. However, you have to use it throughout the calendar year. Otherwise, that money is lost. Okay, so it is the use it or lose it type of policy with a flexible spending account. And there's various types of these accounts. The healthcare, the one in the middle is the account that you would have if you were not in a high deductible health plan. The limited purpose account is the one that you can elect along with the HSA, and you can only use it for dental and vision. And then there's the dependent care account. This is only for child care expenses, such as like daycare, things like that. All of these FSAs, you cannot roll this over. It is all use it or lose it with the FSAs. And then we also offer the commuter parking and transit account. This is another form of a type of a savings account that allows you to put pre-tax dollars into to pay for these specific types of expenses. With healthcare FSA, we do also offer a grace period. So if you are currently in an FSA for this plan year, you actually have through March 15th to incur expenses against the balance that you have for 2024, and then same applies for next year. So you have an extra couple of months to incur expenses. So that gives a little bit of additional time so that you don't lose the money that you have in there. All right. And then if we've got some employees that are out there in the California area, we do also offer Kaiser Permanente. It is a more of like a fully insured plan. This is a very sort of different healthcare model that is available in the California markets. And there is no change to the plan design this year for the Kaiser plan. It's all still the same as last year. And then same pharmacy benefits, and then the monthly premiums are listed here for those that would choose to elect the Kaiser plan. This plan does not come with any of the discounts that we just mentioned, like the biometric screening and the tobacco-free discount. And this plan also, because it is not a high deductible health plan, it could be paired with a FSA, a flexible spending account, but it cannot be, you cannot have an HSA. So those are sort of the details on the Kaiser Permanente plan. And then for Hawaii, we have a group of folks out in Hawaii, and we offer the PPO, HMSA PPO plan there. And there are no changes to this plan. And there are no changes to their monthly premiums. Hawaii has some very specific state laws that dictate what their monthly premiums are. So that is what is driving the price tags here. And then we also offer an HMO through HMSA as well in Hawaii. Okay, and then these are the features here. And for those of you who are in Hawaii, you have an open enrollment guide that's specific to the Hawaii coverage. And we have more information posted in the open enrollment flow as well for Hawaii. Okay. All right, and seeing that we're already at 12:35, I'm going to sort of quickly run through these additional benefits that we have. This is really just high level to show you all everything that's offered. You will have the chance to go into more detail through the open enrollment flow. There's really no changes to any of these benefits except maybe a small little tweak here or there, enhancements, but there's really not a whole lot of change. So I'm going to just kind of quickly fly through these because I do want to save some time at the end if there's any questions that come up that we could help handle right on the spot. Okay. So for dental, we continue to partner with Delta Dental, and we do cover 2 free dental cleanings every year under this policy. So really great value to get dental coverage through Delta Dental. We also have orthodontia coverage as well, up to $1,500. Okay. Then we offer vision through VSP, and no change here. $10 eye exam, copay, and no changes to price tags for this year. Then we also offer company paid life and AD&D coverage, and this is a really valuable benefit. And so we offer 2 times your salary up to $200,000 for both life and AD&D. And then we also offer the opportunity for you to purchase your own supplemental life and AD&D insurance as well. And of course, these are at group rates, so they're much more affordable than should you go out and try to purchase an individual policy. It would cost quite a bit more. So this is a great benefit that we offer to our employees. We also offer company provided disability insurance. So, nobody ever really thinks about, oh, what happens if I can't work? But it really does happen to some, whether it's some kind of health issue or something really taking you away from work. This is really what we call a protection benefit because it provides a portion of your income while you're unable to work for a period of time. And then, if that, health event doesn't allow you to come back to work after the first 12 weeks, then you can be reviewed and potentially receive long-term disability as well. So it's a very valuable benefit that, it's nice to have that protection. And then we offer a menu of various voluntary benefits. We call it voluntary because it's 100% employee paid, but these are policies that would pay you a lump sum dollar amount in the event that something covered under these policies occurs. For example, critical illness. If you have some major health event, then this policy would pay out the amount in which you are enrolled in. And when you go into your enrollment flow, you'll see the different options, a $5,000, $10,000, so on. We also offer the accident insurance. And again, it pays a lump sum cash payment to you if you had an injury. And there's over 150 different injuries and events that could occur that are payable under this policy. The 2 of these policies also pay when you do a preventative exam or when you just simply do your biometric screening program. You could get paid $25 or $50 depending on which of these programs that you're enrolled in. And in some cases, that may almost all the way cover the premium for this in a whole given year. So that's one of those sort of no-brainers. If I know I'm going to go and do my preventative screening or I'm going to go do my biometric screening, then might as well enroll in one of these and additionally get 25 or $50 that covers the cost of this insurance in case something happens, right? And then there's also the hospital confinement indemnity insurance. So this is, it pays a lump sum cash payment to you if you have an overnight stay where room and board is billed. You would get a lump sum cash payout. We also offer legal insurance. They have expanded their coverage to include services for grandparents like elder care, elder law issues, helping with Medicare, things like that. We also have the Allstate Identity Protection. This coverage was also expanded to include cyber protection. So there's more information about cyber protection in the enrollment. And then we have a Medicare advocacy program through Smart Connect. So if you or a loved one is getting to the point where you're considering enrolling in Medicare coverage, then these folks can really help you compare options and choose the right one for you. And so it's just sort of an advisory service. We all know that these programs are really confusing and they have different rules associated with them, and so we really need help. And these folks are like fully versed in how to navigate this space. Our employee assistance program is just a really valuable program. It's available to all of our employees, our union, non-union. Every single Brand Safeway employee has access to Health Advocate. And we cover, Brand Safeway covers up to 5 sessions per issue or concern that someone is facing. So there's a good bit of coverage that I think maybe some aren't aware of what all is there, and it's 100% covered by the company. So if you have any issues, you need to talk to somebody. Sometimes just having another person's objective perspective on the issue can just really make a world of difference. Really encourage just giving them a call. This is what they do day in and day out. So they're very good at helping support folks just sort of trying to navigate life. So it's a great benefit that we offer. We also have an employee discount program that is at workingadvantage.com here. So you can always check that out. The 401k plan at Brand Safeway, this is a really amazing benefit. We match as a company 4% to 5% that you put in. And not only do we match at 4%, but it's immediately vested, meaning you could get into the 401k plan and set your salary deferral to be 5%, and have that set for 6 months. And then you look in your account, well, all of the matching dollars, all of the 4% that Brand Safeway gave you, that's your money. That is your money in your account. Now, of course, there's, IRS rules in regard to when you can use that money, but the point is that it's free money from Brand Safeway to you to get in and take advantage of this. So we just always bring up 401k. That there's not like a required action to take on 401k, but you can go out to the Fidelity site at any time and elect a deferral rate or change a deferral rate. And we have a number of different investment options as well with Fidelity. It's just a really valuable benefit that I hope everyone takes advantage of, because again, it's free money. There's also a number of Fidelity financial resources available out on their site. And this is the Active and Fit employee fitness discount program that we've made available. Hope everybody checks it out. It is on our intranet page. So go check that out. All right, almost done. Getting to important reminders here and how to enroll. Again, we have to take action to have coverage for next year. And We will reset passwords on the night of October 31st. But then when you go in on November 1st or a day, some day after, just put in your birth date, year, month, day, day, and you're off and running. Okay. And we've got the website here. Just a reminder that all of our contact information that's in Workday flows downstream to our benefit administrator. So if you have any updates to your contact information, please make that in Workday. And the key dates that we have. So we've got open enrollment starting on Friday and ending on the 15th. That is like 2 Fridays from Friday. Then we will receive new ID cards. Those that are enrolled in the CDHP will receive a new ID card before the end of the year. If you are not changing your enrollment in Delta Dental, you just maintain the card that you've had. And then the vision, we do not receive ID cards for vision coverage. Okay, so be on the lookout for the medical ID card if you're enrolling in the CDHP plan. Right. We've got one more of this webinar next Monday, and then we'll also be recording some webinars for CRAFT and CRAFT 3 Years of Service, and we're going to be posting all of the recordings of these webinars in the open enrollment homepage as well, just in case someone misses a session and wants to listen in. And then we close up with all of our contacts. These contacts are also listed in the very back of the open enrollment guide. And again, those are posted on our benefits intranet page. There is a tab that says 2025 open enrollment, and we've got that listed there. So with that concludes my comments. And I think Amanda was helping to handle all of the chat as I was talking. I'm going to just open it up to see if anybody has any questions, or Amanda, if you've got any comments based on the chats that you were taking care of.
Thanks, Anne Marie. Fabulous job. No, I think I've got most of the questions answered. But feel free to drop any more questions you have in the chat, and we'll answer them on the spot. The question is, why does Quantum Health still call our quote unquote insurance plan a discount?
I would not characterize our insurance plan as a discount at all. I'm not sure where that's coming from. What I will say is that in every medical plan, we utilize a network that is called the Aetna Choice POS2 network. That is a network of providers, facilities, doctors that we are utilizing in our plan. Those network providers and facilities have agreed to a negotiated discount as being a part of that network, and therefore, if you utilize that in-network provider, you are receiving a much lower cost for the services, both Brand Safeway as well as you as the member receive a much lower cost. So that might be where the word discount comes from, because that is the way that the U.S. healthcare system is set up today. But I'm sure it's just. I mean, if you are on the consumer driven health plan, it is a true insurance plan. So. Perla, we can potentially take the question offline. Yeah. Another question is when we go to the ER, many times because ERs are staffed all 24/7, all around the clock. If the ER is in network, but then the doctor is not in network, then sometimes that causes issues in the billing. However, with that said, we have under our CDHP plan, we have a provision that says employees or members should still receive the in-network level of benefits when it is an emergency situation for which you as an employee or member had no choice of the provider that was rendering the care to you. And so if you believe you are not receiving in-network level of benefits in that circumstance, then Quantum Health can look into that further and ensure that that is happening. So okay, let's take this offline and we'll Perla, and we'll look into the situation further. Okay. Do we have any other questions about open enrollment? Anything else that we can cover?
Nothing else came in, Anne Marie. If anyone has any questions, though, don't hesitate to reach out to us. We are here to support you all. So you can submit a Workday Help ticket. You know, the benefits team is now available through Workday Help. So if you guys need any assistance navigating through that, I can put that information in the chat as well. But we do look forward to you all enrolling in your benefits on November 1st. And I hope everyone has a great week and a great holiday week or months, right? Holidays are up and coming, so everyone prepare.
All right. Thank you all.
Thank you guys. Have a good day.